Hello, my name is Charmaine Slaughter, and I am Healthy Community Brookfield's new Executive Director. My presentation today, Healthy Community Brookfield's Future is in Jeopardy Without Improved Community Relations, will be presented to the Board of Directors. The goals of this presentation is to provide an overview of Healthy Community Brookfield, or HCB, which I will refer to a lot throughout this presentation, summary of key environmental factors, presentation of a SWOT analysis, and proposed strategies and tactics to help HCB thrive over the next 3 to 5 years. So here's an overview of HCB. HCB is a not-for-profit charitable organization. Prior to 1998, HCB was a department of the local county-sponsored visiting nursing agency. As a visiting nursing agency, HCB was responsible for managing 2 state contracts. First was developing interventions and prevention for cardiovascular disease, and second, developing health promotion initiatives in county schools. In 1997, a wealthy supporter donated $2 million to the department to expand its work of health promotion and wellness. And this was the start of Healthy Community Brookfield's development. It became a freestanding organization in 1998. However, it did not have a strategic plan. Programs included nutrition education for teens, babysitting courses, group bereavement classes, and caregiver support groups. And as of today, the services that are available to the community are women's health primary care, prenatal and newborn care, mobile health medical services, employee health and wellness, case management for the elderly, violence prevention, smoking cessation, diabetes education, after-school programs, school health, wellness and fitness programs, well water testing and water problem mitigation assistance, and lastly, vaccines and immunizations. Here is the SWOT analysis that I've gathered for HCB. This analysis identifies the strengths, weaknesses, opportunities, and threats of the organization. So some of the strengths that I was able to outline are that HCB has a working relationship with the county health department as well as the county of Brookfield. The programs and services that are currently being offered by HCB addresses public health issues such as diabetes education, smoking cessation, prenatal and newborn care, and vaccine and immunization services. Some weaknesses are the community is confused about HCB's programs and services. Stakeholders question the mission of the organization. Some opportunities I was able to identify are to collaborate with primary care physicians, law enforcement, farmers, and other local agencies on programs and services. Offer training to employees regularly to keep them abreast with the organization's mission, vision, programs, and services. And lastly, threats that I feel are being faced or could potentially be faced by the organization is to lose funding from the county health department and experience employee turnover. The external environment. So of course, external factors do affect the success or overall success of HCB. The community does view HCB as doing good and that the staff are dedicated, hardworking, and knowledgeable. On the other hand, there is no clear understanding from the community of HCB's overall mission, and there is confusion about programs and services, mainly because there's a duplication of services. So HCB offers services such as women's primary care, diabetes education, violence prevention programs, and after-school programs that are already being implemented in the community by other providers and organizations. Some members of the community still believe that HCB is a visiting nursing agency, or that they are a part of the county health department or the hospital, which of course is not true. HCB became their freestanding organization in 1998. Programs are contingent upon grant funding and county budget fund allocations. So being as though HCB is a not-for-profit organization, we rely heavily on outside funding. And being as though we did not meet the Public Health Accreditation Board's Domain 9 standards, this could potentially impact the current contracts that we have with the county health department. And worst case scenario is that if we don't meet these standards the next year around, that we can lose those contracts. And lastly, county health officials are frustrated with HCB's yearly demands to increase funding. I brought this up because, as I stated before, funding is crucial for our organization, but it's important for everyone to know why we need funding. One thing I have been made aware of is that some of the senior management believe the true goal of HCB is to get funding wherever funding is available or by any means necessary. And that impacts the community relationships that we have with our stakeholders as well as constituents. If we are constantly asking for funding without any clear purpose or intent, that can ultimately jeopardize the relationship and also the funding. So the mission and vision statements are crucial to an organization. The mission statement describes why HCB exists, and the vision statement describes the future where we're ultimately trying to get to. So if you could read the current mission statement, and below it, I have a revised version of the mission statement, which reads, Healthy Community Brookfield promotes healthy practices and behaviors by providing education, programs and services, and outreach to improve the health of Brookfield County residents. Also, the vision statement has been revised as well, and it states health and wellness for the residents of Brookfield. So the proposed strategic goals that I have developed to help move HCB in a positive direction and to ultimately improve our community relationships to stay afloat are as follows. To foster positive engagement with the Brookfield community, stakeholders, and constituents. This can be done by establishing clear intentions and goals for engagement, build trust with the community and constituents, and include community partners and constituents in the planning and decision-making process for programs and services. This ultimately will eliminate any duplication of services, and everyone involved can agree on what types of programs and services are needed and are beneficial to the community of Brookfield. Next, we will meet FAB's Domain 9 standards for accreditation to continue to provide programs and services to the community. This will also secure funding for future programs and services. And third, repair the internal environment of HCB. Make sure staff are clear about their roles and the mission and vision of HCB. So we will achieve these long-term goals to reflect the organization's direction and purpose outlined in the mission statement. So the action plan that I have created, which are short-term efforts that will essentially fulfill the long-term goals previously stated, are as follows. Host monthly town hall meetings with the community and stakeholders. This will be my responsibility as the executive director to facilitate. I do plan to create agendas for each meeting, and I do plan on full participation for all community partners. However, there is a potential barrier that we may not have full participation from everyone. We will also send out consumer satisfaction surveys. This will be the responsibility of the Director of Quality Improvement. Again, we do hope for full participation. However, there is a chance that we may not get the community all involved. And to help mitigate this barrier, we propose to provide incentives for completing the survey. To meet FAB's accreditation, we will create a quality improvement plan to incorporate quality improvement measures in the daily operation. So I will be the facilitator on this project, and we'll work closely with the Director of Nursing, Director of Quality Improvement, and we should have this completed by the end of the year to be prepared for the next review year for the accreditation. Revise HGB's mission and vision statements. Again, this will be my responsibility, and I will be tasked to make these revisions within the first 2 months of my employment here. I'm not expecting any barriers. I do hope to be successful in completing this task. Provide effective in-house training and more funds for external training. So this will be accomplished throughout the year. We will work with the County Health Department for funding and attend any training sponsored by the Health Department. And when I say we, I mean myself. The Executive Director will work with the Chief Financial Officer and the Director of Nursing. And lastly, we will reinforce the roles and responsibilities of the Board Directors and staff. Myself, again, will educate staff about their roles and responsibilities. I would like to hire someone for the position of Director of Quality Improvement in the next 3 months, being as though the Director of Nursing is serving in 2 positions. And I would like to make sure that everyone knows HGB's mission and goals. And to ensure that the strategies and action plans are effective and are carried out accordingly, I will conduct surveys for the community and stakeholders just to ensure that everyone understands and supports our mission, programs, and services. I will compare data on performance measures to see when we did not meet the accreditation standards to our performance after quality improvement plan was implemented, just to see if the action plan or the quality improvement plan actually worked, and to make any suggestions on how we can take what we have and move forward. I will conduct interviews with staff members to test their knowledge about HGB's mission and purpose, as well as roles and responsibilities. And I will use interviews because they capture the personal thoughts of staff, and also I can gather viewpoints to test the effectiveness of the action steps. And lastly, I will develop a goal attainment report, and this will consist of documenting and tracking any community changes that align with the strategic and action plans. So to wrap things up, I do plan that this strategic goals will be accomplished with the help of the action steps that I identified. If HGB is able to improve community relations and to build and develop positive relationships with our stakeholders and constituents, I do believe that HGB has a positive future and that we're able to move forward with implementing our programs and services to address our public health issues in our county of Brookfield. Thank you.